So let us go through the etiology of hematuria. Basic reason for blood in urine is due to any pathology related to urinary tract. So let us get to know how hematuria is related to different pathologies of urinary tract. The etiology may reside in 4 parts of urinary tract that are renal, ureter, bladder, and urethra. Now the renal causes include pyelonephritis, which is a kidney infection and is a type of urinary tract infection that generally begins in your urethra or bladder and travels to one or both of your kidneys. A kidney infection requires prompt medical attention. Next, we have renal calculi, which are the kidney stones, and we also call them nephrolithiasis or urolithiasis, and are hard deposits made of minerals and salts that form inside your kidneys. Then we have trauma or injury to kidneys. Next, we have renal cysts. Now, renal cysts are sacs of fluid that form in the kidneys. They're usually characterized as simple cysts, meaning they have a thin wall and contain water-like fluid. Renal cysts become common as people age and usually do not cause symptoms or harm. Next, we have renal carcinoma. Then, PKD is an inherited disorder in which clusters of cysts develop primarily within your kidneys, causing your kidneys to enlarge and lose function over time. Cysts are non-cancerous, round sacs containing fluid. The cysts vary in size and they can grow very large. Glomerulonephritis. Glomerulonephritis is a group of diseases that injure the part of the kidney that filters blood, called glomeruli. Papillary necrosis. A renal papillary necrosis is a disorder of the kidneys in which all or part of the renal papillae die. The renal papillae are the areas where the openings of the collecting ducts enter the kidney and where urine flows into the ureters. Next, we have tuberculosis. Now, renal TB is characterized by caseous lesions that may necrose and destroy functioning renal parenchyma. Arteriovenous malformation. Now, arteriovenous malformations happen when a group of blood vessels in your body forms incorrectly. In these malformations, arteries and veins are usually tangled and form direct connections bypassing normal tissues. So going towards ureter-related causes that are stones in ureter or carcinoma that resides in ureter. And the bladder-related causes include cystitis, which is an inflammation of the bladder, usually caused by a bladder infection and is a common type of urinary tract infection. Next is the trauma or injury to the bladder. Then we have the stones in bladder, and at last we have the carcinoma of bladder. Lastly, urethral causes can vary as PPH, which is a benign condition in which an overgrowth of prostate tissue pushes against the urethra and the bladder, blocking the flow of urine. Then we have the trauma or injury in urethral portion, and then the stones in the urethra. At last, we have the carcinoma of prostate. So these were the common causes of hematuria that you need to look out for. Stay here as we will be discussing investigations of hematuria ahead.